Okay, I think we can begin. So first off, welcome everyone, and thank you so much for joining us for our first event of this workshop series of the semester. I'm Jummie Akinwunmi, and I'm a member of STEM and Health Equity Advocates. And today we have a panel discussion on how the COVID-19 pandemic has negatively impacted mental health and exacerbated mental health disparities. This workshop is in collaboration with the Black Pre-Health students at Yale and Disability Empowerment For Yale. So without further ado, I'm just going to go ahead and briefly introduce our speakers. So first we have Dr. Ariadna Forray. Dr. Forray is a psychiatrist at Yale New Haven Hospital who specializes in psychiatric and substance use disorders in unique and complex populations that include pregnant women and adults living with sickle cell disease. Dr. Forray was recruited in 2012 as the psychiatry director of the Yale Medicine Adult Sickle Cell Program. She's also the director of the Center for Wellbeing of Women and Mothers, a reproductive psychiatry research program at Yale, where she studies novel treatments for perinatal substance use. Dr. Carmen Parker is an assistant professor of psychiatry at Yale School of Medicine. She is an advocate for patient and provider safety through the promotion of equitable treatment of behavioral emergencies within general surgery and surgical inpatient hospital settings. She's also a strong supporter of diversity inclusion by finding opportunities to recognize and teach about unconscious biases, namely racism, within daily clinical practice and medical education. Dr. Arman Fesharaki is a behavioral neuropsychologist or neurologist and neuropsychiatrist, as well as a basic neuroscience teacher, a researcher focusing on traumatic brain injury. He specializes in neurodegenerative diseases such as Alzheimer's and various types of dementia. In addition to seeing patients and conducting research, Dr. Fesharaki also teaches psychiatry and neurology at Yale School of Medicine. Dr. Stefanie Gillson is a public psychiatry fellow and chief resident of diversity and inclusion at the Yale Department of Psychiatry. She is an institute scholar at the Johns Hopkins Center for American Indian Health, where she focuses on developing community-based initiatives to address mental health disparities among Native Americans through historical and contemporary lens. Aside from her work with Native communities, she is a co-founder of the Women's Mental Health Conference at Yale and the Yale Women's Health Staff Association. And lastly, Professor Grills is a clinical psychologist with a current emphasis in community psychology at Loyola Marymount University. She is a national past president of the Association of Black Psychologists. Currently, she serves as a Los Angeles County Commissioner on the Civil Brand Commission for Institutional Inspections, which focuses on conditions and practices within county jails, probation and correctional facilities, and group homes for children. Thank you so much to all of our speakers for joining us. So I'm just going to go directly into the questions because we do have a couple of questions, and I feel that this might go pretty long, but we're going to try to really stick to the time. So the first question is just very broad, and it's for anyone who wants to answer, but how has the pandemic affected your lives and your work?
Okay, well, I'll start. This is Cheryl Grills. So I'll start with how it's affected my life. I think most importantly is caused a loss of social contact, which is no minor issue when it comes to mental health and well-being, particularly given that I come from a communalistic culture in terms of African American and African culture. Coupled with that is an increased workload, heightened levels of fear for the safety and well-being of family and friends, and then grief, as I've watched a number of very close friends lose parents and brothers and sisters and aunts and uncles. There's also a lot of, my workload has increased, partly because of the increased requests for community supports from community-based organizations that I work with. And on the personal front, also some weight gain because I'm not moving as much, being sheltered in place. But lastly, I'll say on the work side, I do a lot of community-based participatory research. And right now, I'm working with 84 community-based organizations in California that are doing what we call CDEPs, community-defined evidence practices, where they're providing prevention and early intervention mental health services And it has been absolutely fascinating to, one, see the importance of these CDEPs to the mental health and well-being of communities of color. All the projects are focused on the 4 main racial groups, and then the ethnocultural groups contained therein, and how they've pivoted to meet the community where they're at. So trying to track that, trying to capture that has been both fascinating and exhausting.
Great answer.
Thanks.
Would anyone else like to answer, just to give their own perspective?
I'm the only man in the panel. I will wait for the other ladies to jump in, and or I can go ahead, whichever.
I would love to hear your perspective.
All right. Okay. Sure. So for me, the COVID pandemic has been, I guess, it is a personal question, but I'm hoping to be as candid as possible. It's been a mixed bag, and I'll tell you why it's been a mixed bag. On a personal front, I'm Canadian, so my family is in Canada right now, in the west coast of Canada, to be precise. My sister, my family members have been in Canada since obviously the pandemic started. So there's been a major disruption in terms of the family bonds, as I'm sure everybody here can relate to. Just as a personal example, I haven't seen my younger sister, whom I was speaking with last night, since December of 2019, and we're fairly close. And again, I'm sure this is a microcosm of what everybody else is going through these days, but it has been a major disruptive family change for all of us, and we're a pretty tight family. So that's on kind of the negative aspect of COVID changes. On a positive realm, I have 2 young daughters who are toddlers right now, at ages of 2.5 and 4 currently. So if there is one blessing I can say the pandemic has created, ironically, paradoxically so, and I do research, and just like everybody else on this panel is a busy life. My wife was a physician, she works full time. So the pandemic has created within itself this blocks of time that I can spend with my daughters. And to me, that's precious, has been precious for the past 10 months or so. So that's on a positive realm, and I'll leave my answer as such.
I am also experiencing some of the pros and cons that you articulated so well. I am a newly single mom while also trying to be a intricately spoken, precisely spoken, but outlandishly spoken Black academician at Yale, which is all these different hats you have to wear. I need to say what I need to say while also saying it so I can function in predominantly white spaces. It's a hat that has 2 sides, but one check that I'm trying to maintain and not, I like my income, it should stay. So it's been interesting having to, it takes a lot of mental resources to code switch back and forth in order to function in these spaces. And while also being a single mom, with my daughters are 5 and 11, thankfully, my mother braved the trip from Georgia, my hometown, to New Haven to support us during this pandemic learning time. So kudos to my courageous mom. She didn't hardly stop. She didn't want to sleep in a hotel. I swear she put a Rubbermaid bag on top of the hotel mattress on her way up here, but she came. And so it's been wonderful, to your point, of spending time with my kids, but also even now as I'm trying to give this talk, it's mom, and my mom's in the background. Shh. Like, so just like the inundation of having to have the mental faculties to code switch, to have personal life transitions and still be super mom at the same time. It's a blessing to be exhausted. My problems could be much worse, but it is absolutely and breathtakingly exhausting at the same time.
Yeah, well, it's hard to follow, Carmen, because you're always so inspirational when you speak. But I think, I want to echo the fact, of how exhausting it can be. But I also really appreciate, the Arman, your way of kind of looking at the positive in this, right? Because it's really easy to get lost in all the negative because there's been so much negative, right? And I think, if I think back on when this all started, I remember both personally and just with work, just the difficulty in kind of figuring out what was happening with all the uncertainty. And also my husband's a physician, and for all of the month of April, he pretty much was in the hospital in the step-down unit taking care of COVID patients in the midst of, a lot of uncertainty around that. And here I was still trying to, run my sickle cell clinic and run my research and take care of my kids who were distance learning. They're, 10 and, well, they were 9 and 11 at that time. And again, that was a challenge, and it was honestly a really scary time. And I think, it was just knowing that my husband was doing something really heroic and wanting to support him and being able to do that by kind of holding down the fort at home, but that wasn't easy. And then I obviously then returned to work in person as well. Eventually, I was doing mostly telehealth, and then kind of having to figure out how to do that with kids still distance learning, and my parents were still in New Jersey, and us being, very close Mexican-American family, not being able to see them was really hard. And so one of the things that I guess is a blessing in this is that my dad was thinking of retiring anyway, and my parents decided to kind of move that process along, and they moved to Connecticut and have moved in with us, which has been great to have them there and to have that support. But it also means, there's a lot of people in the house and a lot of things to juggle. And I think sometimes, whether it's cultural or not, it's sort of like, we're in each other's space a lot, and having to find, kind of how do you, draw those lines and separation in terms of, okay, right now I have to do work. I can't, worry about this and that. It's always a struggle. But again, I think I'm so thankful and grateful for the fact that, I do have the ability of having my parents with us, of being able to spend more time with my kids in the midst of trying to figure out how to juggle it all. So it definitely has been quite a roller coaster ride, and, just grateful for the time that I do have and the fact that we've all managed to stay healthy.
Yeah, and I guess I can pipe in. I'm really thankful to be here. A lot of these people on this panel are my mentors. And as a resident, I felt pretty supported. And yeah, like honestly, I feel really lucky to have a job. I am Dakota Anishinaabe, and a lot of my family members live on reservations and either don't work, can't lost their job right now, or they have to work and maybe they have pre-existing conditions. So that's been really hard. We're losing a lot of our elders. We're losing the people, my community specifically. It's Dakota with a D, and we have like similar language to like Lakota, which like people know a little bit more, but we're losing a lot of the people who can still speak our language. There's not that many people who are fluent left. But I'm healthy. I've got 2 legs that I can go running around with, and so yeah, it's definitely been quite a balance.
Great, thank you guys. Thank you all so much for your responses. So going off of what Dr. Parker and Dr. Forray kind of touched on, women of color often wear many hats. And during this pandemic, we see them kind of taking on the role of caregivers while also having to balance their own work, while facing multiple forms of marginalization and discrimination. How does their mental health compare to the mental health of men of their same race, or compared to women, to white women? And how are we seeing that change during this pandemic?
I feel like the stress of men in my community is different, but no less severe. having to endure turning on the TV and looking at people who look exactly like you, being publicly executed, and then listening to the justifications and sugarcoatings of the execution. It can be traumatic on top of traumatic on top of hypervigilant. And a lot of our men are primary caretakers now as well. So I think that gender roles in the home are more neutral than once upon a time, but gender roles as you turn on the TV and watch the executions that are publicized, we as women are mourning our Black men. We as women are terrified for our Black men. And then look at Breonna Taylor. You know, there's just there's no space to say, whew, I made it, right, within the Black community, or whew, thank goodness I don't have that risk factor in the Black community. And this whole panel is on the mental health of various communities, and we have so many communities represented here on this panel. That's so amazing. But I think one of the biggest hurdles to your question of gender roles is just there's really no space to say, gee, I'm glad I'm X versus Y today, because we're all just in the trenches together trying to survive and make a better tomorrow.
So just to add briefly to that, I agree with everything that Carmen has shared, and so I don't want to repeat that. I think what I would add is that, everybody's been touting how Black women kind of saved the day with the elections, right? And so we are looked at as the strong Black women, and we can do it all, and we can manage all of these things, and we can be the most, what they call, uncoupled group of women in the country, meaning we don't have partners and relationships at the same rates as other women, but we still carry on and carry forward and wear our many hats. And so one of the things that speaks to is our incredible resilience. But at the same time, that resilience can become our demise, because we are then taking care of everyone else, sometimes at the expense of our own well-being. And that can take a toll on our physical health as well as our mental health. I'm reminded of James Jackson's research at University of Michigan. And he talked about, the HPA stress access stuff. And one of the things that he was trying to convey in that research was that, Black folk are so incredibly creative and resilient that we can outsmart mental illness, if you will. So we'll do everything that we can to protect our mental well-being, but now it's at the expense of our physical well-being. So we'll do comfort eating, we'll smoke the cigarettes, we'll do the drugs or the alcohol, at least, to some measure. And so then we can, not necessarily show the signs of mental illness that you might expect or anticipate, given the weight of multi-generational racial trauma and stress that we have had to endure, that we never got a break from, and that continues to manifest itself on a day in and day out basis, such that, it's almost like we live our lives in constant alert for danger. Where, the stress response cycle has us constantly in the on position. And when you do that, that doesn't just compromise physical and mental health, that compromises quality of life. And at what point do we get to just exhale and enjoy life like everyone else is a big question in my mind.
To piggyback off that, one of the things I hate most to hear is, oh, you're so strong. I don't know how you do it. Oh my God. I'm sitting here like, I'm sorry, was there a sign up sheet? I didn't realize I got to pick and choose hold up, where's the easy sign up sheet? Let me erase my name real quick. And like you mentioned earlier, Cheryl, about gaining weight, like it's, yeah, I'm trucking through, but my BMI is not my friend. And I know it. I'm a physician. It's embarrassing to go to a PCP. You step on the scale and they tell you stuff you dog well know, but I'm like, again, where's the sign up sheet? Because if someone can do it better, step right up. I'll go drink a coffee. Like we don't, so this whole like magical Black woman, she can take a licking and keep on ticking. That's just that frackle knackle out there, because we're only doing what we had to do because there is no sign up sheet. It's not that we're superhuman. It's just, if I don't do it, who will?
And just, I think, to emphasize, right, as Cheryl said, and and what you're saying, that the toll that takes, right? Yes, you'll keep trucking through, right? You'll keep working through, but at the expense of your own, well, mental health and physical well-being. And it's one of the things that in working in my clinics, I hear over and over again, and also I know sort of from family members and friends, because it's, I think, also true amongst a lot of Latino women as well, is just the idea of you go out there, you do it, you women that work third shift, come home, take care of the kids, cook, and keep going and going, and again they do it because they have to, and they have really no other choice. And I think the real tragedy of it all is really at the expense of their well-being. And I think, part of the work I feel, I do a lot of times with my patients, but I think also try to kind of help my friends through, is just kind of how do you, find ways to begin to change that when you can't, because there's so many of these, exterior forces that kind of keep pushing you forward. Like you just don't have time to stop, right? And I think, as Carmen says, like when, and Cheryl as well, is like when is enough, and when is there that break? And I think that's, in thinking about, right, then also the impact of COVID, right, and particularly in our communities, right, like we're disproportionately affected by COVID, and not just the morbidity, but the mortality as well. And I think a lot of it has to do with, and I know I'm probably jumping ahead as to some of your other questions, Jummie, but it has to do, I think, with structural racism and a lot of, the social determinants of health, and how this all plays together, and then disproportionately affecting all of our communities that are represented here today.
Thank you for that. Good evening. My name is Aderonke Adejare. Please excuse my tardiness. I'm a first year in Saybrook College here at Yale University, and one of the organizers of this event, and I'll be asking the next question. So, Black, Indigenous, and people of color have experienced multi-generational racial stress, trauma, and social disparities, which have far-reaching effects on our mental health. Do you see the pandemic as another traumatic event? And if so, how do you think COVID trauma has affected people and will affect people in years to come?
Yeah, I can take a stab at this if I may, and then probably have a different perspective here, and hopefully it's relevant to our discussions as well. By the way, in terms of my background, I'm Iranian Canadian, so I'm Middle Eastern by origin. And in the past 4 years, kind of maybe from a different vantage point, definitely politically, my community has been chastised on many levels, even though I may not be, I'm dealing with it at a different level, perhaps. Again, as I'm just sharing my own perspective here. But I do have to mention that in 2016, when the last administration was elected, my wife, who's also Canadian, made a laughing kind of remark that if we might take refuge in terms of going back to our home country of Canada for now, and the current situation, I can't imagine the current racial injustice if the administration were not to change, how that would really untangle itself in the years to come. And when a few days ago, when Biden signed the quote unquote, the undoing of the Muslim ban coming from Iran and 5 other countries, that was maybe a mild sigh of relief. But the fact that that should be a sigh of relief in the first place, as it to me is baffling. You know, we're living in a Western country, and I thought we were entering the dark ages. And during the current administration. So that's my vantage point on the issue. I can fully only appreciate as a man the many hats that women have to wear these days, as mothers, as care providers, as professionals, as everybody in this panel. I think it's a struggle. And I can only imagine adding the racial dimension to this picture, as I've been witnessing this injustice on kind of imposed on the African American community, the Muslim community, the Middle Eastern community. I genuinely hope, I'm still here. I have 2 daughters who were born here. I hope for their well-being and the fact that we have an African / South Asian vice president in charge right now. I'm hoping that's a positive sign of things to come. So that's, again, my optimistic side of me talking here, but I'm hopeful about the future. But I think a lot of work needs to be done. I think we moved back many, many steps since the Obama years, when I was super excited to be in America. So that's my vantage point that I wanted to share. Yeah.
So I'll add something to that too, from the perspective of someone of African ancestry in this country. I do see COVID representing another trauma, but it's a trauma on top of a long history of racial trauma and oppression for communities of color in the context of a broken social contract and a broken social system that has been trying to break our backs for generations. So it's like trauma in the context of racial madness. And from the standpoint of stress, we already have generations of altered stress response cycles as people of color, and especially from my vantage point for Black people, a stress response cycle that has required us to constantly be hypervigilant and sensitive to danger, sensitive to if I even look at someone the wrong way, if the tone of my voice is off by just 1 centimeter of cadence or tone, that could end my life, that could end me up in jail, that could cost me my job. So that keeps us in a constant state of fight, flight, or freeze, which negatively impacts our health and our mental health. And thank goodness we now have some research in the area of epigenetics that shows how one generation transmits to future generations the stress that they had to bear. And so for the longer term, I think what we are potentially facing are increases in negative physical health outcomes associated with COVID, coupled with chronic stress and trauma. So if we had pre-existing conditions that made us more vulnerable before, we may have pre-existing conditions on steroids going into the future. And that's within the context of a medical system that is disproportionate in terms of access to quality and types of services. I just had a meeting this morning with a public health and economist person who's working with us on our national COVID research project for Congress. And his contribution is going to be looking at nationally, the quality of health care facilities. If I went to a Cedars-Sinai here in LA and I got COVID, I'm going to get certain kind of care because they're going to have a certain level of expertise and equipment. Right down the road in South Central Los Angeles, if I end up going to Martin Luther King Hospital, I'm looking at a whole different ballgame. And that has nothing to do with me. That has a lot to do with structural racism.
Wholeheartedly agreed. And then if we as Black women do go to Mount Sinai for the superior care, we're going to get the second-class citizen superior care. Will they even let us in the door? If I show up with a Medicaid card, are they going to think I'm not in pain? Are they going to think there's so much to it? So COVID, honestly, I think a lot of the reason we're having these conversations now versus 50 years ago is smartphones, honestly, because Black folks have been talking about discrimination for 400 years, but we were trying real hard not to get lynched and dangled from trees if we spoke too loud, right? So we're not saying anything new. It's not surprising. The system is working as designed. I think the Great White Awakening potentially is because of smartphones. Like, it wasn't good enough when we told you, trying not to get killed in the process. But now that you see your neighbor on a video treating our people this way, all of a sudden it's a national crisis. Like, okay. I think technology is, I don't want to, well, I do want to say it. Gillton, middle of the road white folks. That's what it is. And communities of color, Cheryl, you and my community, Arman, your community, Stefanie, Ariadna, our communities can't fix this on ourselves. We didn't create the system. It wasn't broken on our behalf, right? The white supremacists, the white folks got to fix this. They got to fix themselves. They have to police each other. In medicine, if a provider acts outside the bounds of acceptable behavior, we have mechanisms to identify and hold them accountable. It's going to have to be the same thing for white folks, right? So, if there's a social contract, not just, oh, well, Karen couldn't have spoken to that young Black man that way. She drives her kids to soccer twice on weekends, right? It's not just the justification or, oh, they didn't mean to, or no, the system is working as intended. All of this is just a long-winded way to say COVID is impacting us as it was designed to do from systematic centuries of racism. And if there's any sympathy, it's because the smartphone has captured our existence.
Yeah, I totally agree with Dr. Parker and Dr. Gill said. And, I think from an Indigenous perspective, there's 574 federally recognized tribes, right? And there's hundreds more who are not federally recognized, and that's its own problem of its own. So I think every tribe's like very different, but I think that a lot of the things that we can say, and some tribes are doing better than others, but kind of what's already been touched on, like this historical trauma legacy, right? That's continuing to perpetuate like colonized ideas and oppression in our communities. And most Native communities, we gave up land, and in this treaty you were supposed to take care of our health, right? You were supposed to provide us health care and provide us education. Well, that doesn't happen. Our Indian health service clinics are understaffed. They're very, very old. They don't even have up-to-date medical. They're just not safe environments. So it continues to be, people can't get care, right? So I think it's, as everyone already mentioned, it's trauma built on top of trauma. And, one thing I think a lot of Native people say, like, well, we're still here no matter what. You've tried to kill us, you've tried to hang us, but it's like, when is it going to get to the point where we don't say that anymore? Where that's like, yeah, but we're still alive. When is it going to be just, why do we have to keep saying that? So hopefully, maybe this era of technology will change that.
No, I also think that Carmen raised an excellent point that it's unfortunate it has to take technology to jump in here to make people aware of the tragedy that's happening on every day on the streets that has been happening for decades. Is that, that be it, video of George Floyd, that 8-minute segment, it should take that far, and it's tragic in a way, but I do agree with you. Facebook and the havoc they've wreaked on our society these days. We saw it on January 6th. It's just unbelievable. So I think keeping both sides in perspective, I think, is essential. But I really appreciate Carmen's point as well.
Okay, we talked a little bit about infrastructure of the healthcare industry in general. So this next question is, how have deficiencies in mental health infrastructure, like access and affordability before the pandemic, affected how we're dealing with our mental health now during the pandemic?
Well, unfortunately, I mean, this is not surprising to anybody. We didn't have enough and appropriate mental health care before the pandemic. And obviously when we need it more, because we've seen the increase of, anxiety, mood disorders, substance use, in response to the stress created by the pandemic and the other issues happening in the last year in our country. And so we're now at a point where we don't have the capacity to provide that healthcare. And I think, unfortunately, again, who are the people that, are going to be most affected by this are the people that had limited access to begin with, right? And a lot of those are our communities, whether because of, again, I think the example that Cheryl, mentioned about, you can live in the same city and have very different access to the quality of healthcare, right? And that's very true. And I think for a lot of communities of color, they're stuck with the suboptimal access to begin with. And they're probably the communities, not probably, they are the communities that need more. And I don't think we have an answer yet, unfortunately, about how to meet those needs.
Yeah, one of the things I'd like to add to that is, so we kind of got two things going on, at least. I mean, there's more, but on the one hand, we have, when it comes to mental health services, we have what's called an adaptive dilemma. This many people potentially need certain mental health services. This many people can actually get it, right? And that's for everybody. So we've developed an untenable system that cannot possibly meet people's mental health needs. And we're doing that in a society that doesn't really reinforce and support the basic foundation of a healthy, whole society. If anything, COVID has shown us in how all the different ways that as a society, we need to do a better job as human beings, right? And then you couple that with, for communities of color, we have, in California, we call it the 3 U's. We've been unserved, underserved, and inappropriately served. And in that context, then you have folks who may need mental health services who don't actually access them or can't access them. And it's because of a number of reasons. The services are not reachable because you don't have insurance. The services buck up against stigma issues. The services don't resonate with our folks, because another huge elephant in the room when it comes to mental health services is that people of color are being forced to subject themselves to evidence-based practices which have not developed adequate evidence for them. If you go and you actually look at the studies and who were the participants at the start, you might have 100 people, 10 might be Black, 2, if you're lucky, might be Native American, 4 or 5 might be, Latinx, and maybe 1 or 2 Asian American. Then when you go through, they have to do a 16-week, intervention, some type of CBT or something. And then you look at the sample, who did all 16? And the people of color numbers dropped down drastically. But then it seemed to work for the remaining 70-something people. And then they conclude, and it works. And now everybody has to do it. And then our elected officials and public policy folks collude with the madness and create bills and requirements and insurance company requirements that you only can offer these evidence-based practices. But our folk don't want them. They don't relate to many of them, and they are culturally bankrupt. So, so I think that we have a lot of issues going on with access. And then when you just even look at insurance, I was looking at some recent studies, and they were showing how, for the disparities in access to care and treatment for Black folk, even with the implementation of the Affordable Care Act, it helped close the gap in terms of uninsured individuals. But for Black folk, not at the rate that it needed to be reduced, that gap, in order for more people to be able to access the services. And so now when we're in COVID and folks are really stressed, they're having an even harder time trying to figure out how to get, professional help. And the private folks in private practice, even those who are doing pro bono, the people of color, all my friends that are clinicians, they are booked solid. They can't take on anyone else, even if they were offering it for free. And so people are hurting out there. In LA, we've started community-based approaches. We're doing healing circles around South LA. We had 1,200 folks go through healing circles where we train community members to provide emotional support and stress tools to gang members. We got gang members who are going into spaces and places where they've left stuff for folks, right? Healing rocks. Yes, gang members are going in and looking for, I need a healing rock, right? Because I get stressed too. And I want to keep my stress down because that keeps my violence down, right? It keeps my sense of danger down. And people are saying, literally in the qualitative data from this is better than that therapy I had to go to at such and such a clinic. I'm finally feeling heard. People see me. I see myself in other people's stories. This feels like a sense of family. I feel relief. I feel like I can make it through this. And this is with non-professionals, but it's a community-driven approach, which if we're going to deal with that adaptive dilemma, forget race and everything else, we're going to need to figure out how to do more kind of natural healing, self-help support kinds of stuff.
And I think the wonderful thing about that is also it kind of gets at one of the other issues related to mental health, right? And that's the stigma, right? And I think when you have sort of a community-based group like that, or sort of intervention, it kind of can help overcome some of that stigma. And I think that that's particular. I mean, I think the stigma is across the board, related to mental health, but I think it particularly impacts, I know, definitely the Latinx community in terms of, mental health, and what is that, and depression, and kind of, that's not something that happens to me. That's not something that happens in my family. It's something you just kind of push through, right? It's not something you have time to deal with or think about. It's sort of, I've often heard people say, well, it's a white people problem, right? But it's not, right? It's just that that's the perception. And so I think that's another issue sort of to think about, is the stigma. And I think that's a great way to address it.
This is my disclaimer that I'm about to be the Debbie Downer, but So I work in a public psychiatry setting alongside Stefanie. And one of my big things with saying people of color don't go or don't present mental health services, tying in with your point, Cheryl, that our services often suck. Even if you're getting the gold standard, you might be better off going to your pastor. because I have so many Black men with no daggum paranoid schizophrenia diagnosis. I want to take their charts and burn them on fire. I'm sorry, it's bull. It's so much bull. And as a Black provider sensitive to these things, they could come up and check every day one med school SIGI CAPS criteria for depression, and providers are still like 4 times more likely to say, oh, you're psychotic, and God forbid you use religious coping. Now you're religiously preoccupied, and goodness forbid you're scared of the police. Now you're going to be paranoid schizophrenia. The concept that medicine has something good to offer Black communities as a default is complete hogwash, not by default. We have providers who will go above and beyond, investigate life learning beyond what's in their textbook. I took my boards in September. The questions were so racist, I don't even know what to say. All of this race-based medicine, I can't. One of the vignettes was a woman was walking downtown one night and she got raped and now she has nightmares. What, blah, 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 blah. I'm like, why couldn't she be at a frat party in Wisconsin? Rape only happens in the inner city. I just, Debbie Downer, I'm aware, but going to your church, you might be better off. Oftentimes you are. And the studies show that the church helps us too. My mama is a reverend doctor, internist on top of an AME minister. And we just actually wrote a paper with my mama. Yeah, that was kind of fun. Who writes a paper with their mama? Yeah, I do. But it was saying that, mental health resiliency in Black communities is our church. And centuries later, they did some studies and it actually works. Yes, it works. And you don't have to face the paranoid schizophrenia when you go. I'm just saying.
Yeah, I think, I am always constantly in awe of the medicine men. And also, as, an MD, right? I've come from such a historical legacy where people maybe shouldn't trust us. And, so I think it's definitely a balance. And I think the medicine men, they help manage things a lot better than we can with our westernized medicine.
I think just piggybacking, one thing of what Carmen said, because it just made me think about it. And I just made this connection with a patient I just saw this afternoon in clinic. And, that it also speaks to how important I think it is for medical schools and for just, the medical education system in general to really, really, truly invest in providing more culturally competent care, right? Because I sat in clinic today and had a young Black woman who has struggled with depression and at times has had psychotic symptoms, talk to me about, how she's been coping and the difficult time she's been having. And I think anybody else listening to her say how, when she was really distressed, had this vision, that she felt came from God to her as a way to show her the way and her strength, right? And she described it very elaborate, kind of with a lot of detail and was very elaborate, and I sat there and could understand that for her, that's just how she's coping, right? That's her, kind of her finding her resilience and the strength in her religious beliefs. I think any other provider would have said, oh, she's off her medications and having psychotic symptoms, right? And I think, so again, I think it really is so key, and I think we need to do a better job, as medical institutions, as medical schools in general, to really be able to teach that to the future generations of doctors, to really be able to step back and recognize and understand patients from a holistic standpoint in a culturally competent way.
And you all just reminded me too of, I was just reading a study recently. It was a phone-based experimental study that documented racism, genderism, and classism with respect to accessing mental health care. what they did was they called 326 licensed therapists in New York. And they had either a middle-class person or a working-class person call, a man or a woman, a Black middle-class or a white middle-class person. Who got appointments? Who did these therapists respond back to? Middle class over working class, white over Black, and not as much difference about women, but a little slightly more tendency to respond to women. So implicit bias is right there in the room, right along with the quality of services that are being offered. And unlike what Dr. Forray was mentioning, you don't get people who have that sensibility like she does to understand the cultural underpinnings of what someone might be saying. So when I'm saying, God, talk to me, I'm saying that within the context of my spiritual reality and worldview. That doesn't mean that you need to then classify me as hearing voices in some way, shape, or form. So, you know, yeah.
Great, thank you for talking on this point. What is it? I think we have time. Well, we'll see. But the next question is, what are some signs and symptoms to look for in others that may show that their mental health is declining? Given the stigmas around mental health in POC communities, how can we approach members of our communities to tell them that they should seek help without being confrontational?
I had a recent, I just wanted to add my quick bit, if I may. I had a recent interview with a local news here, and I wanted to kind of make a point clear in terms of what to look for, and from an everyday perspective. And I couldn't help but think of, to talk to a batch of psychiatrists here, to a kind of definition of Freud in terms of one's ability to love and work. And I disagree with a lot of what Freud had to say, but this bit kind of stuck with me, that it's kind of in terms of our ability to hold relationships together and be able to function on a day-to-day basis. That, from a functional perspective, that could be a metric to look for in our loved ones, in our close friends, in our partners. So I think that's probably a good lens to look through that. I ask my patients about something as mundane as sleep, and which is often overlooked. And there are many studies that have been done in the realm of sleep and how sensitive that can be affected in depression, anxiety, PTSD, psychosis, bipolarity, all this spectrum of psychiatric disorders. And if there's one question, I think I tell my medical students and residents, it's one practical question to kind of look for, is simple as sleep patterns. And that could be a good window to look into someone's mental health. And it could be a useful one for that matter. And I also wanted to add one kind of unrelated point, but it's somewhat related to our discussion. And as I'm saying it as an Iranian/Canadian, and my family lives in the north border, and we have what is called socialized medicine, which everybody has access to, a minimal standard of care. And I'm comparing the numbers of COVID patients and folks who are affected north of border versus US. And the numbers are just uncomparable. And they haven't had the vaccine yet. Of course, there are many political miscalculations and frankly, huge tragic mistakes that have been made, that I won't get into that. But just the idea of access to care and the fact that how demonized socialized medicine has become in the US, and the fact that we're seeing the outcomes of north of border, and where they still don't have access to vaccine as of yet. But the numbers are a fraction of what we have here. Irregardless of your racial background, there are many Asians, Native Americans, African Americans, they're all ethnicities in Canada. So it's, in a way, is kind of second cousin, I guess, to US. But it's just so unfortunate, this systematic dysfunction that we see in US versus Canada. I just want to add that in, yeah.
Well, I would say that there's like at least 6 categories that we can kind of be self-assessing as well as paying attention to those that are in our life. Emotionally, how am I doing? Am I kind of burdened with a lot of fear and anger or apprehension or sadness or guilt or feeling hopeless, feeling numb, feeling irritable, more than has been the case for me, right? Cognitively, what's going on with my thinking? Am I having nightmares? Am I having confusion? Am I hypervigilant? Am I overly sensitive? Am I having problems with concentration and memory? Am I overly critical and blaming, which is not typical for me? Am I having problems problem solving? Third, behaviorally, what am I doing, right? Am I withdrawing from the people that are my support system? Am I overworking? Am I doing things that are kind of antisocial? Is my behavior erratic? Am I acting suspicious? Am I using alcohol and drugs more? Am I avoiding the kinds of things that used to bring me pleasure? And then am I having problems with my appetite, you know, eating too much or too little? Am I having a lot of clumsy stuff going on in my behavior? And then fourth, physically, how am I doing? Am I having twitches or vomiting or weakness or chest pain, or my blood pressure going up? Am I having gastrointestinal problems like nausea and diarrhea? Is my breathing getting more shallow? Am I fatigued all the time? Am I having, as you said, Arman, am I having trouble with sleeping? Am I having a lot of headaches? Am I grinding my teeth? Am I, you know, it's like my jaw always sore. And then the next one is spiritual, right? Which we don't always think of, but for people of color, we've got to do the spiritual awareness assessment attention. So am I feeling a lot of emptiness or loss of meaning, or feeling unforgiven, or like in martyrdom phase, or am I becoming apathetic or feeling alienated, having a crisis of faith? And then lastly, kind of social effects. Am I, you know, more muted in my communication with other people? Am I more isolated? Am I lacking empathy? Am I becoming more inflexible? You know, those kinds of things. So where am I on these different fronts? Any one of them can give you a sign. When you see a confluence of them happening, it's time for some kind of support of some sort. And like the intro psych student or the entering psychiatry resident, you know, or you start seeing yourself and all the signs and symptoms. So there's always that danger as you scan yourself and others. Oh, check, 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 check. I must have this diagnosis. So we have to be careful with that.
It was so interesting, the like symptoms that you mentioned. Like, as you said, like clenching your jaw, I had to like unclench my jaw. Like, just as you said that, I was like, oh wow, wait. So thank you. Anyone else have like anything else to add to that? I feel that was really comprehensive, though. Thank you, Dr. Gross, for that. What is it? And our final question is, what are some ways we can take care of our mental health?
For me personally, it's been giving myself some forgiveness and the ability to not be okay, as opposed to putting on my Black woman, superwoman cape. Like, my cape needs to go to the dry cleaners. I ain't worn it in a hot minute. I'll put on my Supergirl cape in a minute. I mentioned the example of the BMI. It's terrible, guys. Like, it's so bad. But I'm also having to just give myself some grace that, yes, it's a priority. It's not, you know, especially when it's hard when your values don't have space in your reality, if that makes sense. When your distractions and to-do list and stressors and extra headaches by virtue of being born this color versus that are subtracting from your self-care, I find it meaningful to boldly acknowledge, be able to pause, prioritize, reprioritize, and redo it again, and then have the courage to get back on it when I've achieved those reasonable milestones I gave myself the space for.
I just wanted to mention, I really like Carmen's answer of self-compassion. I think that should be the precursor of all mental health treatments, and it's very understated. So I wanted to start by saying that. And if I may, I just add a couple more points to that. And as personally has helped me, and also I say this to my loved ones, to my patients, and that's the value of mindfulness meditation in all these different varieties. Could be in the context of prayer, could be just simple breathing techniques. For me, it's been very consequential, and I've dealt with family tragedies, and it's been a savior, personally speaking. And I'm not saying it's a recipe for all, but I think it's I think there is an increasing recognition of the value of it. So let me put it that way. And the final point I wanted to mention, it's easy to say exercise, but journaling, writing one's story down, narrative down, something you can always look back onto, even a single line or two. I tell my patients this, and especially the ones who are dealing with mental health issues, that one's ability to even write a few words down, I think, can go a long way to tracking one's progression and well-being, for that matter. So I really believe in the value of that. So.
Yeah, I think reiterating that self-compassion, right? And kind of giving yourself a break. Again, I can't stress that enough. So having said that, I think another thing that can be really helpful is, and that we don't do, and I think we have to be much more intentional about doing, is to really allow ourselves, whether it's 10 minutes or it's a full hour, it's a space to just kind of be and do something we enjoy every day. And again, it can be 10 minutes, it can be a full hour. And if you have the luxury of 2, fantastic. But again, finding a time where you can just do something you enjoy. It's something to kind of, it's part of sort of the self-care of just kind of giving yourself that space in that moment. I think that can be, because and you have to be intentional about it, right? Because it's you, if you're not intentional about it, you're not going to do it. But that can really go a long way to really just disconnect us. Otherwise, we're surrounded and bombarded by all the stuff going on, and to really take the time to do that and do whatever activity it is that you enjoy to do in that time. And I think with that, the other thing that I think was really helpful and crucial for definitely for me, and I know it was very helpful to others, especially as the pandemic was unfolding and all the events kind of later in the summer and through the elections, through this earlier this month, right, is to really limit your access to social media and to the news, right? And I would, tell folks, it's like, you have an hour, give yourself an hour, and that's all you give yourself in terms of checking, Twitter and checking the news, because otherwise anything more than that just then becomes counterproductive and actually toxic. And so I think that was just another thing that I think would be really important, is to just really limit your access to news outlets, social media, etc.
And ditto to everything my colleagues have said. That grace with yourself. We've been practicing among this little group of us here. We don't say I'm sorry anymore, or we try not to. You know how, because we're not up to par. So I'm sorry I didn't get this to you on time. I'm sorry that's not the best quality. And we replace I'm sorry with thank you for your patience. So everything is thank you for your patience, right? So it's a reframing for ourselves, but also reframing it for the people in your world. And then this notion about self-care is so important. In fact, one of my favorite Audre Lorde quotes is that self-care is not self-indulgence, it's an act of political warfare for oppressed people. And then I think the last thing I'll say is that we need to rethink what's resilience. Resilience is not hardiness. It's not grit. It's not that little, piece of that little plant coming up through the concrete. That is not it. I think about, we talk about in the resilience toolkit of resilience, I talk about it as like a pot of gumbo. It's got a lot of ingredients that make it, what it is. And everybody has their special combination, their secret sauce to make their gumbo or their menudo soup or whatever it is, that's special. And so the ingredients in the resilience gumbo for, stress and trauma purposes, we got our genetics. We can't alter that. We got the role of epigenetics. That's a given. We got neurobiology. That's a given. But beyond those three, now we can modify things, including attending to your physical fitness, with nutrition and physical activity, attending to your religious or spiritual life, paying attention to the environment that you're in. Is it too noisy? Is it too toxic? Is it unsafe? What can be adjusted to make your environment conducive to your resilience. Positive interpersonal relationships. That is a key. That is a foundation. What's going on in the quality of your relationships with people and where can adjustments be made? Social justice involvement. When we start working on something greater than ourselves, that in and of itself can pull us up and out. And then lastly, the psychology underlying resilience. How much positive emotions do you experience in the course of your day? Optimism, hope, how much can you regulate your emotions? To what extent can you reframe negative into positive? How much can you be in the present moment, like some of the mindfulness encourages us to do? How much active coping and decision making? Where's your moral compass? How's it doing, right? All of those things actually are what makes up resilience. It's not how tough you can be in the moment of difficulty.
I want to piggyback on those awesome thoughts for just a second to my earlier comment that there are certain adjectives and compliments that aren't very complimentary. I don't want to be praised for anything that belongs to a Ford truck. I don't want to be called sturdy. I don't want to be called a high workload. I'm not dependable. I'm not reliable. If it belongs on the truck lot, then don't call me that. Praise me for compassion. Praise me for dedication, but don't talk about the load on my back as if I'm just like, competing with the Dodge Ram. A lot of people think they're being complimentary and mean so well, but this perception of Black women especially, we are not Black trucks. We are just as dainty and delicate. I can't cook, but girl, your gumbo sound good. I mean, it's just, let's not forget that we get to be feminine and just as fluffy as we want on top of dealing with all the junk of society's imposing on us.
And on that note, I think that is a good place to end. We would like to thank all of our speakers so much for taking out the time out of their busy schedules to be here with us, and thank them for all the hard work that they're doing. Unfortunately, we were not able to have a Q&A portion of this, but feel free to reach out to any of the speakers through email. Here's your emails below. This is gonna kind of format weird because it's Zoom, I think. There's their emails. We would like once again to thank our partner organizations, Black Pre-Health Students at Yale and Disability Empowerment for Yale, BPHY and DEFY, for helping to plan this event and the questions. And also, as many of the speakers said, there's a lot of discrimination within the training of medical professionals. So we would ask if you would please join SHEA in signing this petition to Yale Medical School to address and start providing anti-racist education to medical professionals. So there's the link to the full petition in the chat. And if you go there, you can find the link to sign, but here's also the link to sign the petition. We would like if you could support our efforts there. And please look out more in the future for other events hosted by STEM and Health Equity Advocate SHEA. Thank you.